team. This is Andrew Hoskins, Country Director for Medical Teams International, Uganda. And I want to start by saying a huge thank you for the progress that we are making as a team. We are being recognized as the leading organization in refugee healthcare here in Uganda, and that is because of you. I want to remind us of the behaviors that we try to reflect in everything we do. The fourth behavior says we are reliable. We do what we say we will do. We have the courage to ask for support, and we take responsibility for our actions. I admit that in the area of salary payments, we have not been reflecting this behavior. Month after month, we say we will pay salaries on time as MTI, but then the money comes late. Now, this is unacceptable, and we must improve immediately. It's not fair to you, and it's not reflecting our behavior. So let me be an example of this behavior and have the courage to ask for support. I need us all to work together to improve our payroll system so that we can get payments done on time every month, and that money can hit your bank account. This meeting is to talk about what we can do together to get this done. The payroll process begins by us reviewing the following areas: job titles, job descriptions, supervision appraisals, and organizational charts. We want to make it clear what everyone does and how it fits into the big picture. So let me go through each of these one by one. At the end of this meeting, everyone should receive an updated version of your job description that you will go through with your supervisor so you know what is expected of you. If you do not receive a copy of your job description, please let me know. I want everyone to have this basic information. Some of you will have a change in your title. Now, if this is you, you'll receive a letter informing you of the change. I want you to remember that your salary is not going to change at this time. We are currently conducting a salary review across the whole organization, but any changes will only happen at the end of the year, not right now. Just to give you one example of how job titles have been combined or changed, we have the senior clinical officer title and clinical officer title that we've just combined to make one title simpler in our payroll system of clinical officer. We've done this to make our payroll process smoother and more accurate, not by changing salaries, but just simplifying the title. So we still recognize the seniority of certain staff in certain titles. As we review job titles and job descriptions, we recognize the need to create roles. Now, these roles are already happening at each health facility, but we've never written them down and given them a description. Because these tasks that the roles perform are critical to the functioning of the health facility, we wanted to formally recognize these roles and provide guidance on each role and what it should be doing, so that it's the same across all MTI health facilities. Now, at most of our health facilities, with the exception of a health facility 4 or hospital, we have 10 roles. And you can see them here on this slide. Remember, these are different from a job title. For example, a registered midwife, that's a title, but a head of maternity is a role. So a registered midwife might have the added role of a head of maternity. It's important for any staff assigned to a role to read through the role description together with your supervisor, and that will be given to you after this meeting. The in-charge will share with you all of the roles that have been assigned at your health facility so that you know who to go to for each of these roles. Now remember, we can't offer additional salary for these roles right now, but I'm asking for your support. We need these roles to implement our new payroll process and to model our behavior of empowering. Together we can do this, but only if we work as one team. So let's take a step back. Many of you might not even know exactly who your supervisor is or who you are asked to supervise. This may not seem very related to getting your salary paid on time, but believe me, it is. You've heard the terms direct supervisor and technical supervisor. So let me clarify. Your direct supervisor oversees your daily work, signs your timesheet, approves your annual leave requests, and leads your performance review process. Your technical supervisor mentors you in the technical aspects of your job and also gives input to your performance review. For many of you, this can be the same person, but for some of us, they're different people. Let me give an example. The direct supervisor for a driver is the in-charge at the health facility where they work, because the in-charge oversees that driver's daily activities. However, the fleet assistant at the field office is the driver's technical supervisor, because the fleet assistant is advising on areas of vehicle maintenance, vehicle logs, fuel management. You get the idea. Each job description lists your direct supervisor and your technical supervisor for that job. To help each staff know who their direct supervisor is, we created organizational charts for each type of health facility. So this chart only shows direct supervision. Technical supervision will be listed on your job description. This is the basic layout for a health center 2. The shaded boxes in gray are roles, not titles. So your title might not be showing up on here, but you would probably have a role in that case. Your in-charge will talk through this with you in detail. Now, at a health center 3, there are more staff, so we have a larger organizational chart. For health center 4 or hospital levels, the structure varies quite a bit per location because we integrate with government staff. This organizational chart is only showing MTI staff. Your in-charge should talk through this and you will know at the end who is the supervisor in each department. Lastly, we've modified our performance appraisal form so that there is space for both direct supervisors and technical supervisors to give input. Your direct supervisor should sit with you to review this form in detail so that you know what areas of performance we will be evaluating. Now remember, your job description is the main document that guides what you should be doing in your job. So your supervisor will use your job description to measure your performance. MTI requires performance appraisals to be done at the end of a probation period or at the end of the year when your contract is being renewed. But we encourage supervisors to have frequent conversations, even weekly, with the staff that they supervise. Let them know what's going well and what they can improve. Remember, we work as one team. So the next steps. Everyone should receive a copy of their job description and of the role description if they have one. You should receive a letter if your title is being changed. And everyone should meet with your supervisor one-on-one to review these documents and sign. I want to close by reminding us of our second behavior listed here. We work as one team. We have each other's back, working toward one goal, agreeing on priorities to accomplish that goal. Right now, our goal is to ensure that everyone gets paid accurately and on time at the end of the month. I'm asking for your support so that we can do that together. You are all in my prayers. Thank you.